Welcome. I'm Ragan Johnson, an associate clinical professor at Duke University School of Nursing, and pleased to introduce my co-presenter, Dr. Marquita Lyons-Smith, who's an assistant clinical professor at North Carolina Central University's nursing program. Additional presenters and supporters of this project, Dr. Ann Derwin and Dr. Bridget Carter, could not be with us today, but we wanted to share our summer immersion program to improve advanced practice nursing workforce diversity. We have no disclosures to report, but this project was partially funded by a HRSA grant for nursing workforce diversity. Our objectives for this presentation are to describe the collaboration between HBCU and PWI to increase advanced practice nursing workforce diversity and name some specific pipeline program strategies important to reaching that goal. Some background here. As you all know, over the last year, of course, we've had an increased call for diversifying the nursing workforce, and a lot of great reasons why. There are a significant number of Americans living in a health professional shortage area, and NPs are primed to bridge that gap. So increasing diversity in NPs, we hope, and we've seen there an improvement in outcomes of minoritized populations, that when patients and their providers both language and race align, you see an increase in comfort, trust, and cultural understanding. But as you can see from the chart on the left, the numbers of Black nurse practitioners decreased from 2018 to 2020, with a significant decrease in Asian as well. And as you can see from this chart, Indigenous populations aren't even represented at all because the numbers are so minute. Right now, there's no data on DNPs available, but a shift to DNP entry to practice will certainly change that and may have the potential to further marginalize Black nurses from advanced practice. Some of the biggest challenges we see to diversify the nursing workforce is nursing education. And so barriers are historical in terms of racism, structural and both social racism, lack of faculty diversity, cost, and access all prevent Black nurses from accessing higher education. The lack of Black faculty or faculty of color, we know, results in no Black faculty on admissions committees or in leadership in academia. Some Black students are still unaware of the graduate process, how to be a nurse practitioner, or what are the various types of advanced practice roles that are even available to them, where to find financial resources for paying for school. And then once in programs, a lack of inclusion or micro or macro aggressions may also prevent Black students from completing higher education programs. So we wanted to really think of ways to bridge these gaps. So we worked with faculty and nursing leadership from North Carolina Central, which is a local HBCU, on developing a pipeline program. Several pipeline programs are available for undergraduate nursing, but we didn't really see many that targeted current RN students that were interested in continuing their education to the graduate level. So first, we started off by hosting several collaborative workshops at Central for all current RN students, where we introduced Duke faculty and the various programs that we have to offer. But we wanted to go even a step further and develop a summer immersion program that would offer additional intensive support. After reviewing several frameworks that worked, we thought about mentoring networks, which instead of assigning one specific mentor to students, we show students how to develop a mentor of 3 to 4 people that they can lean on for various reasons. Clinical exposure, we wanted to make sure that they had access and knowledge about what the various types of NP roles were. Peer support has been heavily discussed in the literature, and we know that sometimes within programs, especially PWIs, there's often a power dynamic even amongst students. And so you think about who has access to materials, who has access to support from faculty, prior years information, et cetera. And so we want to make sure that we show students how to navigate those dynamics as well. And finally, we wanted to discuss leadership and professional development, because we know for a lot of students, particularly students of color, it often builds their confidence.
Thank you, Dr. Johnson. I will discuss an example of an intensive support opportunity as mentioned. LEAP, the Leading to Equitable Access to Health Professions program, is a component of the Duke School of Nursing Office of Diversity and Inclusion. It offers mentorship to increase nursing students' readiness for successful entrance into an APN program. APN faculty and APN graduate students participate in this mentorship process. We'll get into a few more details later, but the short and long-term objectives that you see here influence every aspect of the LEAP Summer Immersion Program to be discussed. First, we aim to improve the APN workforce diversity via early exposure to the graduate school experience itself. Secondly, we do acknowledge the value of promoting collaboration between HBCUs and the PWI. Lastly, we will use previous research and the immersion process itself to continuously design effective strategies to increase access and reduce perceived and real barriers to APN education. So you see here our first LEAP Scholars cohort, which included students from North Carolina Central University and North Carolina A&T. And the majority of these students, 4 out of the 5 participants, were first generation college students. So we are sure their families are very proud of their current success and their future goals. These scholars enthusiastically participated in several planned activities, but we're going to limit our discussion to just a few of those. They received a brief overview of various APN roles and actually had the opportunity to interview an APN panel. These were active nurse practitioners that were practicing from our local community, some within the scholars' desired specialty areas. They also had the opportunity to interview student nurse practitioners on a separate panel. Both of these panels were very generous with their knowledge, insight, and they were very honest, and the scholars really appreciated this. Professional development, whether verbal or written, was stressed by reviewing resumes that were submitted with our applications for feedback, and essay entrance prompts were also reviewed with feedback. The students also practiced their interview skills and expanded their knowledge of personal leadership qualities that they may not have even realized that they currently demonstrated, and we expanded upon these qualities that they already had. They learned how to build and maintain a mentorship network while also utilizing proper etiquette, which is very important, to foster diverse and long-term relationships with minoritized APNs and other very important members of the APN community. Also, Dr. Bridget Carter, Assistant Dean of the Office of Diversity, Equity, and Inclusion at Duke School of Nursing, gave the students an excellent overview of the APN's expected contribution to health equity. We'll talk in detail about some of the activities that the students participated in on the next slide, but just as a note, they did receive a stipend for their participation in the program. As you can see here, understandably, because we are nurses, our nursing students, the favorite activities included hands-on clinical exposure alongside Duke graduate students. These activities occurred in the lab and in the classroom setting, and they involved several different specialties. We'll just mention a few: pediatrics, women's health, acute care, and separate simulation experiences within those different specialties. As you can see, in some cases, they had their own setup and were able to practice various skills, which included things such as advanced assessment skills, orthopedic evaluations, and IUD placements and suturing as well. They were particularly engaged in the debriefing process, but as a whole, this entire hands-on experience really piqued their interest in the overall graduate school experience. The LEAP scholars answered a variety of post-evaluation questions, but we are happy to report that 100% of them, all of them, were very happy with the program and its meeting of their goals that they set upon entry. We are also optimistic about our short-term success on meeting the objectives that we put forward. One of the questions we posed for them: describe how the LEAP program helped to prepare you in determining your career aspirations. One of the students decided, maybe I don't want to be an advanced practice nurse as far as a nurse practitioner, but how about I'll be a nurse manager? This broadened our thought process about what the program could offer the students as well. A second student had more clarity on the APN role and the process towards becoming an APN. A third student that we'll call our new recruit was very hesitant about graduate school itself, but towards the end of the program, she became newly interested and more convinced. A fourth student took a deeper dive into the networking process and actually came away with an active list that she's going to build upon. And our fifth student is very convinced that she wants to be a pediatric nurse practitioner, but towards the end of the program, she had a more expanded view of her role, her future role, which she really appreciates. The students gave us a lot to think about as far as future goals. They really wanted us to expand the program and make it longer, at least 2 weeks minimum, so that they can participate in some of their favorite activities, more one-on-one time with their chosen mentor so that they can be guided along their professional journey, and more hands-on time with their nurse practitioner students, where they're doing activities or just private time to ask more questions about graduate school. And of course, more time from the beginning, end of the program and towards graduate school so that we can help them towards their stated goals. Now, our goal is to partner with the setting goals for their futures, to partner with the MSN program to offset some of the application costs for the scholars. This is huge. Finances is something that's come up quite a few times, so that's definitely an important goal to pursue. And then thinking about having these students to enter into the Duke School of Nursing MSN program early. How do we brainstorm a bridge program to make this possible? And lastly, of course, we want to have ongoing contact for persistent mentorship with these scholars. We want to be able to motivate them, encourage them, and offer helpful resources that will push them towards their stated goal. And we want to promote future LEAP scholars by that continuous collaboration with the HBCUs and offering information sessions about the APN process and answering other questions that they might have on a quarterly basis. We want to thank you for allowing us to share with you our efforts to support and promote APN diversity in the workplace via the LEAP program. And here's our contact information if you have further questions, and of course, our reference page to follow.